Hello and welcome to the Pediatric Brain Tumor Foundation's webinar, Palliative Care's Role in Your Family's Brain Tumor Journey, Clarifying Common Misconceptions. My name is Heather Held, and I'm the Director of Family Support for the Pediatric Brain Tumor Foundation. I want to thank all of you for joining us today for this important subject. Before we get started, I have a few guidelines to review. You are muted for this webinar and your video is disabled, but we will welcome questions during and after the opening remarks. Please type those questions into the Q&A feature found at the bottom of your Zoom window. We will try to get to as many questions as possible, but we may not be able to answer them all today. We are pleased to welcome Dr. Chrissy Salley alongside parents Anne and Nils for today's webinar. Currently, the Director of Clinician Engagement and Outreach at the Courageous Parents Network, Dr. Salley is an experienced psychologist with expertise in delivering support and intervention to parents and caregivers of children with complex medical needs. Alongside Dr. Salley today are parents Anne and Nils. Originally from Germany, they moved to the Carolinas 10 years ago, where their youngest daughter, Martha, was born in 2017. It is Martha and their family's experience that they will share with all of us today. It gives me great pleasure to welcome now Dr. Salley, Anne, and Nils.
Thank you, Heather, and thank you all for sharing this time with us. It's the afternoon here on the East Coast where I am, but it may be the morning where you are. So we appreciate the time that you've committed to this topic and for joining us today as we cover what palliative care is and how it can be helpful to your family, as well as addressing misconceptions that are really common for this topic. Before I dive into some of the primary content for today, I'd like to ask Anne and Nils to introduce themselves briefly and to say something about their family.
Hi, I'm Anne.
And I'm Nils. As you saw, we're parents of 4 wonderful children, and we will talk more about Martha's treatment, her journey, and how palliative care was a great support for her and for us, and is to this day. Looking forward to the session.
Thank you. Okay, I'm going to share screen here, and you should all see my slides now. So as Heather mentioned, I work for a nonprofit organization called Courageous Parents Network. We are in our 10th year. We are a disease agnostic nonprofit organization, meaning that we cover topics that are common for families caring for children with all kinds of serious health conditions. We tend to the social and emotional aspects as opposed to medical information. There are a lot of things that we cover and support in terms of the family's caregiving journey, I should say, but the most important to us is this idea of pediatric palliative care, which was essential to the care received by our founder and executive director, Blythe Lord, as she was caring for her daughter, who had a rare genetic condition more than 20 years ago. We speak a lot about palliative care and how it can be helpful to all kinds of families who are at all different stages in journeying with their children through the healthcare system. We are the only organization that serves as a liaison to the American Academy of Pediatrics section for hospice and palliative care. And I have no disclosures. I'll start today by just debunking the most common misconceptions right from the start so that we can have a mutual understanding of these things and just set them aside, out of sight and out of mind, really. So oftentimes when someone hears palliative care, they either don't know what it is or they have only heard of it in context of being a support to someone at the end of their life. So perhaps they've had a parent or an aunt or uncle or a neighbor who received this service. And because of that connection, oftentimes people assume that palliative care is the same thing as hospice care, or that it is for end-of-life care, either for children or adults. And that is not the case. So hospice care does include palliative care, but it doesn't work the other way around. Palliative care is an extra layer of support that an individual and their family can receive at the time of diagnosis of a serious health condition. So one of the things that we work really hard to convey is this idea that it really can help you from the beginning and ongoing, no matter what the ongoing looks like. So as I just said, it can be received anytime after diagnosis, and also it can be received alongside treatment. It's not an either or thing. It is not removing different types of supports or interventions. So individuals receiving palliative care can and often are receiving some sort of treatment at the same time. There is a misconception that it is removing support or intervention. If you hear, some families may hear the term raised and then have a concern that their healthcare team is quote unquote giving up on them or their child, and that's just not the case. It is always more support, not less. And finally, while you're always thinking about what kind of care is available to help your child and help improve their quality of life and well-being, palliative care is not just for your child. It is here to serve your entire family. So I hope that as we continue through the rest of today's presentation, you keep those things in mind, that it can be received with treatment at any time, and it's for the entire family. So to further illustrate this point, this is a snapshot of a handout that we have on our website at courageousparentsnetwork.org that provides a nice chart comparing palliative care with hospice care, talking about similarities and differences. And there's also a column here for concurrent care, which you may be aware allows children to receive potentially life-saving treatment or cancer-directed treatment while they're receiving hospice care. So that used to not be the case, but children can receive treatment during hospice care, and of course palliative care as well. This is available, as I said, on our website if you want to use this as an opportunity to review these differences and similarities in more detail. It's also a great resource to share with friends and family who are journeying with you and wanting to understand the similarities and differences in these concepts. Throughout today's presentation, you are going to hear from not just me, but Anne and Nils later live, and also some short videos of other parents and clinicians who have been there along the way, because you don't need to just hear my voice about this topic. I hope that hearing the experience of others gives a more robust illustration of what palliative care can look like. So to that end, I'm going to introduce to you Dr. Rick Goldstein, who is on the palliative care team at Boston Children's Hospital, and he's going to talk about his perspective on what palliative care is.
But the first thing I'd want them to know is that this is not the end of hope. This is the beginning of finding your way. And that's what I'd like them to understand that our mission is. At the very least, we try to support and problem solve people so that in these set of circumstances, there might be resources available that they're not so aware of. There may be phone calls that we can make or forms that we can fill out that will help them in a small, concrete, good way. In what I think are better conditions, we can also really help clarify, we can help advocate, and we can also walk alongside of you and or the families for as long as they need us, and in whatever way they need us, so that they have somebody that they can turn to that is not involved in the bedside decisions on a day-to-day basis, who is invested in helping them understand the big picture, and someone who's worked to understand what they're hoping to achieve in these things, to participate, an informed voice that's sympathetic and advocating of the broader ambitions of a family. we also introduced this attention to suffering, which is a real part of what we think about and try to reduce. And I suppose in that way, there's an important distinction. So a liver doesn't suffer and a lung doesn't suffer, but a person suffers and families suffer. And we think that that's really important in the care of a child. And we work with the subspecialists to make sure that that gets attention as well.
There are a few things that I like to point out from Dr. Goldstein's video. One is that he references a few examples that are concrete in nature to think about how palliative care could help an individual family. It could simply be things such as filling out forms and making phone calls. It can also be at a much deeper level of having really difficult conversations and supporting the family with things like communication and decision making. The other thing that I appreciate that he acknowledges here up front is that while your neuro-oncologist or oncology team's number one priority is treating the brain tumor, your child's health condition, and certainly they're invested in everything else that has to do with well-being and your child's experience, their priority is always the treatment. Whereas the pediatric palliative care team is also invested in the treatment of your child's health condition, but it's the flip. It's secondary to their primary lens and viewpoint is looking at all of the other things that go into well-being for this child and the family. And so in that way, pediatric palliative care really is a complement to the medical support that you're getting with your child's care team. So pediatric palliative care is a specialty. People get specialized training in pediatric palliative care. Physicians have fellowships that give them a more in-depth training into this area of expertise. But it's not just a specialty. We think of it as a clinical paradigm or a clinical mindset and how one approaches the care, looking at a person holistically, their physical, their emotional, their spiritual well-being in one picture, and how to provide support to enhance all of those areas in one's life while they're undergoing treatment or living with a chronic or acute healthcare condition. To that end, it does address really deep-rooted problems for children that have the highest need in our healthcare system. There is a huge emphasis on interdisciplinary care. And so what they will often do is work as a team. So in some places there are pediatric palliative care teams, which may consist of a physician specialist, a nurse or nurse practitioner, psychosocial clinicians like psychology, social work, child life. And they also gather teams to have common experiences, communication, and meetings sometimes about with a family about their child's care. As I've mentioned already, they're really directed at the patient-centered outcomes other than a cure. They are invested in the cure process as well, but they're looking at the bigger picture. And finally, one of the things that I think is most important about pediatric palliative care is the emphasis on the parent and caregiver of this child as being the child's greatest asset, their greatest advocate, and the person that knows them the best, the person that can speak to the family's values and goals, and are really at the center of the child's care. And to that point, they're always looking to equip parents to be the best parents they can be. And I'm going to say a little bit more about what I mean by that, being the best parents they can be. There is a huge body of research that actually started in the pediatric oncology realm, although now has expanded to other illness groups. It is led by a nurse researcher named Dr. Pamela Hines, who started to look years ago at how parents thought about their experience as a parent to a child with cancer. And through a series of interviews, she identified that from the parents themselves, they had this idea that they wanted to be a good parent. Now, that's not a label the researchers gave. This was elicited out of the parents' communication and feedback. And I'll also say there is no opposite. There is no such thing as a bad parent that we're talking about here. But I like to raise this point because this is something that all of us who are parents can relate to, whether or not we're caring for a child with a serious health condition. The fact is that no matter how you define it, all parents want to be a good parent to their child. And what does that mean when your child is also facing a serious health condition? So a few years ago, Courageous Parents Network was actually involved in a study with this research group. And there were 10 major themes that came from families about what it means to be a good parent to this child under these circumstances. And the things that came to the top were that they wanted to be a strong advocate for their child. They want to convey love to their child and to others to know that their child is loved, to provide the best care possible. They want to be able to comfort their child, to create meaningful memories with their child, to help their child reach their fullest potential, to seek some balance amongst the many roles they have as a parent and caregiver, to develop their own medical insights and understanding, to respect the child as a person, as a whole person, and to weigh their child's quality of life. So these are some of the things that pediatric palliative care clinicians understand and will support you in reaching these goals and ideas as they pertain to your needs as a parent. So I think it's important to note that palliative care is actually a standard of care in pediatric oncology. So about 10 years ago, well, actually the work on this began over 10 years ago, a national group of experts convened and identified a number of areas within the pediatric oncology space that are psychosocial in nature, which means they address the social, the emotional, the behavioral aspects of oncology experience for children and their families. And they did a large, robust review of the research literature at that time, as well as taking in their own clinical expertise into consideration. And from that, developed standards of psychosocial care in the pediatric oncology space. And after all this research, this group of authors here, as you see on the screen, did in fact note that palliative care should be a standard of care in pediatric oncology. And they wrote it such that the standard says, youth with cancer and their families should be introduced to palliative care concepts to reduce suffering throughout the disease process, regardless of disease status. When necessary, youth and families should receive developmentally appropriate end-of-life care, which includes bereavement care after the child's death. This project was funded by a nonprofit organization called the Maddie Miracle Foundation, and it's really been an important shifting point for programs across the United States, at least, in thinking about how well they are meeting the standards of care in their setting and how to boost resources in this area. So I like to note it because this is a resource and a publication that most parents aren't familiar with. But I want to put it on your radar that it has been deemed as a standard of care and is something that you have access to or ought to have access to. So now that we're shifting from what the general idea of palliative care is, I want to go into more oncology specific thoughts and examples on this. And so next you're going to hear from Amy Graver. Amy's the mom of 4 children. Her daughter Lauren had cancer, rhabdomyosarcoma. And their family had a really positive experience with pediatric palliative care. So I'll ask you to hear just 2 minutes of Amy's story. I'll note that Amy is a parent champion for Courageous Parents Network, which means she's one of a small group of parents who join us for presentations talking about how palliative care benefited their family. And so this video was made for her role in that program.
My 6 words are, I wasn't always a cancer mom. because on July 12th of 2014, I wasn't, and on July 13th by 2 p.m. we were meeting with the oncologist. So there's a real clear definition of my pre-cancer life and my life since then. Within a week, we saw a palliative care physician. We really just met with her for pain management, and then I learned more about palliative care and how rich it is, symptom management, coordination of her other healthcare teams, dealing with different therapies, and just how to make her life better as she dealt with cancer. So they were doing things that enabled her to go to school, hang out with friends, be pain-free, be symptom-free as much as possible. And that was really improved the quality and the quantity of her life. And it made an impact not only to Lauren, but to her siblings and to myself and my husband. While her oncology team was working to solve for tomorrow, palliative care was working to solve for today. I consider myself, after my experience with palliative care, as a palliative care evangelist, and I would love to spread the word about palliative care to other families.
I've had the wonderful opportunity to work with Amy on a few projects, and she always has lots of really beautiful nuggets and words of wisdom. But this quote that she says in this video, which I put at the top of the screen here, is one that is going to stand out for me forever. I find it so meaningful, and I think it almost summarizes perfectly about what palliative care really is. It is focusing on the big picture, all of the things that are going to make today as good as it could be, how good it is possibly to be for your child and your family. And during today's presentation, you might be thinking everything that we're talking about that palliative care offers kind of just sounds like good healthcare, right? Like, shouldn't the healthcare system be thinking about our emotional and our families, our entire family's needs, and shouldn't there just be really great communication, and ought decision-making be shared among a provider and a family, and ought that just be natural? But the reality is that the healthcare system that families are in, as wonderful as they can be, some of the priorities are mismatched to families' needs. And you may have experienced some of this yourself, where you say, gosh, I really value these parts of the care that my child is receiving. But there are gaps here. I see the people working as hard as they can, but sometimes, I want to say things like, when a new provider walks in the room, gosh, didn't they read the chart? Right? Why are we explaining what our child is like again? Did so-and-so not speak to so-and-so? Why is it that one person's sending us this sort of messaging about our child's condition and another person is sending this kind of messaging? So even when the healthcare system is doing and working at its highest level, there are still needs that are not fully met for families. And palliative care is one piece of that that can help fill some of those gaps. In this next video, I'm going to show you Carrie. Her son Kai was diagnosed with a brain tumor, and you'll hear from her articulate what one of her needs was that she felt was not being met at a period of time for her son.
Quality of life, he was in a lot of pain throughout his life before diagnosis. And even though there were glimpses of times where he was progressing and developing normally and smiling, there was a lot of time where his quality of life was unacceptable. He was in pain, and I didn't know it at that time. So once I found out, yes, I was right about my instincts, and yes, he was in pain, I just felt like I could never let that happen again. And if he is in pain, there's a reason for it. And it doesn't matter what the reason is, it's unacceptable. And if he is, if his abilities are decreasing, there's a reason for that. And we need to do whatever we can to make every day count at that point. I mean, even from early on in diagnosis, when they painted the picture that this was he would be a long-term survivor. You say long-term survivor to a mom with an 8-month-old, what does that really mean? You know, and I would ask them that, and they would say, whoa, we have children with this tumor who are 20 and who are off treatment. And I was like, 20 at 8 months old, 20 doesn't mean anything to me. He's 8 months old. I need his life to be good now. And that's, you know, I wanted to make sure he was not in pain. I wanted to make sure that he was living a life that was worth living. Living in a hospital for the next 20 years, hooked up to machines, was not an acceptable life to me.
You'll hear, there are more videos of Carrie and in fact all of these families talking about their experiences on our website, but what you hear in other videos is how palliative care helped Carrie and Kai through their journey. And actually Carrie now works in the palliative care space many years after journeying through treatment with Kai. So what does palliative care help with? I'm going to try to again, be a little more concrete here with some examples, because I do think that because the nature of palliative care is so holistic, that in some ways that can feel a little amorphous. And when it comes to thinking about your family's unique experience and your child's unique needs and how that maps on. So I'll continue to give more examples as a way to hopefully help you see yourself somewhere in all of it. So of course, symptom management, this is like the most straightforward thing that palliative care can help with. And you're going to hear 2 more parents in a moment speak to symptom management, but we're talking about things like pain, nausea, sleep problems, and that sort of thing that might be helped by medications. Maybe your child is on medications to support those areas of needs, but they're not working as well as you hope they might. Maybe they need something different. Maybe they need a cocktail of a few different things. Palliative care teams can be creative in how they think about approaching these symptoms because, you know, as Amy said earlier, they're solving for today. They really want your child to be comfortable now. And so there can be a large focus on symptom management. However, that's not all. So there are a lot of ways they can help, even if your child's symptoms are managed well. One is emotional distress. Certainly if your child's having challenges with anxiety, but also the emotional distress experienced by you as parents. And sometimes they even get involved with siblings and help with communication in the family in that way. They're invested in taking into consideration families' spiritual needs, seeing parents and what their spiritual needs are, how that might play into the decisions that they make for their child, how they need or do not need that to be central to their care for their child, but also in seeing your child as a spiritual being and having those needs as well. Certainly they're wonderful at helping with care coordination. So if you have Dr. A, Dr. B, and Dr. C, and they're just not talking to one another, palliative care jumps in oftentimes and helps coordinate those calls and communications, which I think can be really helpful when you might be part of a system that you're struggling to make that happen in yourself. Decision-making can be a very large piece of palliative care support. They are experts in communication and thinking about the many, many, many decisions that you as a parent have to make for your child under these circumstances. This can happen from the beginning or at any time along treatment, but it may be especially helpful if you're anticipating that you may need to make a change to your child's treatment plan, or if there is a transition point where you may need to decide whether or not you want to continue with treatment or not. I can also give an example from my own practice. In the past 2 years, I've worked with 2 different families of children with brain tumors who, in both cases, these children had experienced a recurrence and were on treatment again, doing well on this treatment, but neither of them were being treated on a protocol. And in both situations, and these families were at 2 different institutions, so it wasn't the same provider, but in both situations, the families were confronted by their team with the issue that at some point we will have to end this treatment. The child is stable, they're doing well, and we have no protocol to follow, right? So are they going to receive 3 more rounds of this, 6 more rounds for this? And there's a balance between things like, obviously, number one priority of a cure, but also the balance of knowing that there may be some toxicity the more treatment that they have. And that was a really difficult position for both of these families to be in, where they were having to make a really difficult decision with not a lot of science to guide them in how they approach that. So this is a place where values and worries and concerns and goals and hopes can be put on the table, and palliative care can help with that. That's a really good example of where they can jump in and support you. They can help with family communication. They often can bring in referrals to other services if you're not already receiving them. And they do a lot of work on the advocacy level for families. I hear families give examples where they feel like they are not being heard by their child's medical team. But palliative care can do some of that speaking on behalf of them to make sure that they're heard. I can also think of an example where some providers were questioning a decision that a parent was making, and the palliative care team was right there by her side and said, Mrs. Smith has really given a lot of thought to this. She's thought about it for a long time with a lot of detail, and this is the decision she's made. And that parent felt very supported in having someone stand alongside them and reinforce what they thought was best for their child. And then I've mentioned this already, but layered on top of all of these areas and domains that palliative care might help your child or you with, I just want to reinforce the idea that palliative care can happen the day of diagnosis and any time onward, even including into survivorship, which is not common, but some children still have a lot of symptoms that need to be managed as they transition off treatment. And there's no reason you couldn't consult with the palliative care team to get some insight in that area. So with that, I'm going to take a break from speaking for a moment and transition over to asking Anne and Nils to say a little bit about their journey with their child as another experience related to palliative care.
So first of all, I want to say that every experience is very unique, and we can just talk about our very own journey with our little daughter, Martha. So Martha's our youngest child of 4, and she was diagnosed with a brain tumor in February of 2019, and she was just 1 year old at that point. And back then we lived in Orlando, and she was treated at Arnold Palmer Hospital. And after she was diagnosed, she declined very fast, and she got a lot of high doses of steroids. She got a shunt, and she got radiation, emergency radiation, and that saved her life at that point. So the palliative care team was involved from the very beginning and over the course of her whole treatment as part of Martha's care team. So they joined every appointment we had with our team. And that gave them the chance to really get to know Martha and to get to know us. And it helped us and gave us the chance to really get to know them and to build trust. So that was very important for us.
And I guess we were very privileged that this was the hospital's policy, that this is really an integrated team. So let me say, I think everything that you mentioned and the other parents mentioned is spot on, and it's exactly what we experienced. So the whole cycle, starting with the misconception. So you get the diagnosis, and I'm sure all parents can relate, and you're overwhelmed, and you don't know a lot about the cancer world and treatment, and suddenly there's this palliative care, and our first reflex was we don't want anything to do with them. This is end of life. We are in fight mode, and yet the palliative doctor was present, as Anne said, so he was mostly observing in the beginning, and he was there And I wonder if I might have been rude to him sometimes because I just didn't feel comfortable. Then later, over the course of treatment, it turned out to be very supportive. So one, the oncologist or the other care team would turn to him and ask, well, how can you support from a palliative perspective? How can we deal with the symptoms? There were a decision to be made. Should we follow? There was no protocol for Martha's tumor either. So should we follow this direction or that direction? What's the impact on quality of life versus what are the chances that this has an impact? So it was good to just have someone in the room who would look at it from another angle. So we the whole time we had this palliative care and treatment at the same time. So Martha was really treated until the last day. She was on several studies, not clinical trials. There were no clinical trials, but we tried different options, and at the same time, even when she was in hospice care for the last weeks of her life. And the palliative doctor was actually present when she passed in our home. So he really was there from the very first day to the very last day and beyond. So when we had questions a year or 2 years in and we couldn't make sense of, well, why did she die in the end? He was open, he was available to answer those questions. And he knew exactly how to talk to us because we had built this rapport over the time. And even now, some years in, there's still events and ceremonies that the palliative team invites us to, and we would go to Orlando and meet other parents and honoring our children. So we treasure that a lot, and can just support that. It's important to not only look at the treatment from one perspective, but look at it from all the angles.
I wonder if you can share, I know you have other children in your family that were all older than Martha. Is there a way that you think palliative care may have directly or indirectly through you benefited the other children?
So I think they work together as a team, and we had a social worker who works with our doctor very closely, and the kids really trusted her. So because of them working together as a team, they got very close to them, and they saw him a lot as well, and they trusted him. But I think it was more the social worker who really, she is still in touch with the kids, and she could answer all the questions, but with his help. So even there, they really work closely together, and the kids benefited a lot of that.
And we had some memory making events when it was clear that Martha had reached end of life. They came to our house and then did some memory making, fingerprints and some necklaces. So that's something we would not have thought about at that time, and we treasure that a lot now, and this always involved the whole family. So yes, definitely helpful for the whole family.
Well, thank you so much for your sharing your story and perspective on palliative care. One of the things I love from your example is thinking about this extra body that was in the room, right? That at first you were like, why does this person need to be here? But that is part of the role they can play because they're always listening, absorbing, and getting to know you as parents, as caregivers, as decision makers, as individuals, as a couple, right? And so they can develop that sort of expertise on you over time so that when the time comes that you have to make a difficult decision or that they need to answer the hard questions, they have a sense of who you are as people.
We actually requested the medical records, and so we have all the memos and all the records from those meetings, and there was very accurate reports from the palliative doctor who, over the course, you can see how he experienced Martha, but also how he experienced the whole family. So you could tell he was really observing, yeah, the family as a whole, and not just the patient or the diagnosis.
And shortly before she passed, we had palliative care and hospice in our house. And I was very unsure with letting just the hospice people being there when Martha was about to die.
Mhm.
And they saw that that I was very unsure about that. So they said afterwards, okay, if the time is coming, or when the time is coming, we send someone from palliative care. And it was our doctor who came in then with our social worker. So that was super important for me, and I think for our whole family.
Yeah, there's so much consistency in the care when you have
Yeah.
that model. Yeah. Thank you. Is there anything else you want to add before we continue on?
No, just thanks for doing this.
Of course. Thank you for sharing your story. We are actually going to, I'm going to show another video clip here. This is Amy, who I introduced all of you to earlier. And she is going to share an example of how palliative care helped with pain and nausea for her daughter, Lauren. You will hear Amy reference Aaron or Dr. Flanagan. Dr. Aaron Flanagan was their palliative care physician.
We had just redone their room. When she was diagnosed, she weighed 65 pounds. She was now down to about 41 pounds. And we had been in the clinic the day before, and I said, can you do anything? Like, the girls we had just redone their room. She didn't want to sleep in their room because she was throwing up. She was embarrassed. She would make it smell like just, would wreck the whole vibe of the room. So she was with us. And I said, can you do anything? And they're like, well, we're going to have to increase maybe we'll do 10 hours or 12 hours. I'm like, how is she going to wear this to school? And they're like, she's in school. I'm like, oh, yes, she's in school, and so I pulled Aaron aside. I'm like, I'm going to lose my mind. All they think about, they're just myopic. All they think about is cancer. I'm like, if we could get the vomiting to stop, then maybe I could get her to eat something, because I know they're going to talk about a feeding tube. I know they are. I can feel it. And so, and then, then the just not feeling good, and her worries were sky high during that time. And I'll never forget, you're like, I'll be right back. You walked down the hallway, you came back, you gave us a prescription for amoxicillin, because you said sometimes
erythromycin.
Erythromycin. And then you gave us, you called, why am I blanking on her name? Joanne Lindell, right?
Yes.
You called and got an anti-anxiety medicine for her, and then we went on medical marijuana that day. One conversation with Aaron turned into 3 new prescriptions. The erythromycin worked that night. That night, she didn't vomit. The next night, and so 24 hours she doesn't vomit, 48 hours she's back in her room. Within a week, she doesn't have to have the TPN anymore. We went on her Make-A-Wish trip, went on her Disney cruise. She gained 4 pounds on that cruise, 10% of her body weight. She came back and continued to gain weight. And she got up to 56 pounds because of Aaron, and then draws that picture of herself. So that day, that's another day you changed our lives. I don't know. I'll never forget that day.
I just could not get them to listen. And you said, look, they'll deal with cancer. I'm her pain doctor.
So how do you know if you need palliative care or want palliative care, if you think it's right for your child and your family? I hope that you gain some insight from other families today that might trigger some thoughts in your own mind about how they might be helpful to you, a palliative care team or provider. But I offer here for you some questions for reflection that you might consider for yourself. One is asking yourself, how is my child's quality of life right now? Is my child able to do things they enjoy, at least some of the things that they enjoy? How am I doing in managing the care of my child? Am I feeling heard and understood by my child's providers? Am I anticipating a big decision ahead that I might want some support with? And does my family just in general need more support? And I think that if you endorse any of these questions, even if a little bit, you might consider asking for a palliative care consult from your providers. I'm going to share with you one final parent video on the next slide. This is Dr. Sarah McCarthy. She is a colleague and friend of mine. She is a pediatric psychologist, as I am, and her specialty happens to be pediatric palliative care. She works on a pediatric palliative care team. Several years ago, Dr. McCarthy's daughter was diagnosed with cancer. And 5 days later, she was diagnosed with a second different type of cancer. This is a highly unusual situation, probably some percentage of a percentage at a decimal point of how rare this is. But here, Dr. McCarthy will share a little bit about why she knew she needed palliative care.
Initially, I got palliative care involved really from a symptom because I was concerned about symptom management. And I will say, though, I also got them involved because I needed support. And even though they no longer had a psychologist on their team, because that was me, I really needed that kind of the wraparound care that palliative care provides. And I think especially because it was COVID and friends couldn't come in, family couldn't come in. After they found the second cancer, we did get kind of dispensation of both parents in the hospital because, again, nobody knew what was going to happen. But we still had another child at home to take care of. And so, oftentimes when I was getting any kind of information, I was by myself. And so I wanted that level of support for myself as well. And so the symptom management piece, right away, we started seeing it was just invaluable. And I think that oncology does a wonderful job of, oncology loves their protocols, and I'm a researcher, I very much understand why we have protocols, and I think they do a lot of good, especially around symptom management. But with Molly, nobody knew what these symptoms were going to look like. And so instead of having to kind of we try this drug first and then this drug and sticking to kind of the usual way of doing it, I think everybody was much more open to thinking outside of the box. And again, I think that is where palliative care does just an incredible job of big picture thinking. I think that because Molly's cancer profile didn't fit anything anybody had ever seen, there was just more openness to let's bring everything in. We did a lot of acupressure. And again, I think that's sometimes something that's thought of, or complementary therapies are thought of kind of down the road when you try the other things, but we were able to start that almost immediately. And again, I think really helpful. So I think, from a symptom management standpoint, that was really important. And from supporting me. And then also when I was not in the hospital and my husband was there, they were another team that you could just really support him and make sure he understood what was going on. And I think they also did a lovely job of joining rounds and including him in the conversation as well. Every single oncologist commented on the benefit of having that team involved. And then when things got really hard later that year, they were, again, their experience was just invaluable. And I think people were extraordinarily, the team members from all the different teams, from GI, from, I mean, I swear everybody was involved in her care. People were very grateful for their kind of expertise.
So where can you find palliative care if you decide that it's something that you would like to have involved in your child's care? Most obvious answer to this is to look for it at your child's treating hospital. There are different models for how palliative care looks in hospitals. Some of them have a team that serves the entire hospital, which would mean, yes, oncology, but they also see families in the NICU or other departments. In some cases, the oncology team might have their own designated palliative care provider or team that serves just the oncology families. So it can look a little bit different about the who and how, but it is available at many children's hospitals, certainly the bigger ones. It is possible, however, that your child is being treated at a hospital that does not have a palliative care team or even a single palliative care provider. In that case, you can look to see if there is a community-based program that offers pediatric palliative care. There are community-based programs that offer palliative care and hospice care that have a palliative care arm. Just beware in some of those circumstances, the providers sometimes, unless it's not a designated pediatric palliative care program, the providers might be more so trained in caring for adults than children. That doesn't mean they can't be helpful for you, but just something to keep in mind as you're searching to see if there's something that your family could benefit from. And what if you find that it isn't available at all, or you're not ready to invite palliative care into your family's experience? Actually, I'm going to back up for one moment. I want to say that when you approach, if you're going to approach your child's oncologist or your social worker or whomever you feel like you can speak to about adding palliative care to your child's care, it is possible that your child's team, your child's doctor may say something like, you don't need that, or you don't need that right now. And in that case, I really encourage you to push back on their own misconception about what palliative care is and how it can be helpful. I give a lot of these presentations into helping families understand what palliative care is, but the case is that the misconception permeates healthcare as well. And you should feel empowered to push back and say, if you are thinking that palliative care is only helpful if things are really bad, if my child's quality of life is really poor, or if it's just when they're approaching end of life, that is not what palliative care is. And go ahead and keep pushing and advocating and saying, our family wants this additional support during our experience. And you can also reference our website, which has a lot of resources on what palliative care is that you can share with your team and family and friends, like I mentioned earlier. So again, back to what if it isn't available, or what else can you do? One of the things I want to mention here is that you can think about how you might build your own palliative muscle. So if we go back to one of those very early slides today, I spoke about the fact that palliative care is a paradigm or a mindset. And so you can start to adopt that for yourself and stretch and exercise the palliative muscle, that internal palliative voice, as you care for your child. And so what does that mean? That means understanding and embodying the role as the expert on your child and family, which means that you can and should and will advocate for your child in all ways. You are their number one expert. You know your family's values and goals. And so continue to advocate for them however you see fit in your healthcare system. The second thing to note is to think a lot about decision making to the extent you can, particularly when you're not facing a hard decision and you have an opportunity to do some reflection. Ask yourself some questions about your decision making and thinking about what guides you in the decisions that you make for your child. Ask yourself, if I relied completely on logic and what's rational, what decision would I be guided to? If I relied entirely on what my heart says, what decision would that lead me to? is there a core value for our family, for how we want to parent and care for our children, that we want to test all decisions against as we make them? What decision might my child want me to make for them, right? So ask yourself and get a sense of how you go about making decisions, and allowing those things to come together and lead the way, as opposed to relying just on one thing. Certainly consider what role of all the other supports play in your coping as a caregiver, the meaning that you're putting to this experience. How do you activate new social support? What, if any, role does spirituality play in your caregiving journey and taking, and your loving care for your child? What are other sources of strength that I draw on as an individual, that my child draws on, and that we as a family draw on? Use resources that you need that help you feel more equipped to engage in conversations with your care team. So be looking for resources that give you the language to use when you're talking with your providers. Look for resources that help you feel like you can and should advocate where you need to, and then enhance your perception of yourself as being a good parent, like we talked about earlier today. And certainly we have a lot of resources on our website that you can refer to help you in that way. And again, I'm being a little redundant here, but think about what matters most to you as a parent, as being the center of your family and the parent to this child, and always bring forward what matters most to you. And do not hesitate to say things in your meetings with your team, like, this is what's important to us as a family. This is something we're really curious about. We're worried about our child's quality of life. We want to revisit the medications that our child is taking for symptom management. We want to be able to do more things that are building good memories. We want to have good days now, not knowing what the future looks like. Bring it forward in these meetings, and you should feel empowered to do so. So on a final note, though, if you really want to know what palliative care is, and again, Amy says this essentially earlier in her video, that it's really about making today the best day it can be. And you can always fall back on that definition and understanding for yourself to combat some of those misconceptions maybe you have, but also to share that way of thinking with both your providers and family and friends around you. And with that, I'm going to stop sharing screen, and I will ask Heather to share if some questions have been entered into the chat.
Thank you so much, Dr. Salley, for the practical information that you've shared with everyone today. And Anne and Nils, thank you both as well for sharing your journey, and Martha and your family with us today. Anne and Nils, why don't you go ahead and turn on your camera and join us as well. We'll see if we have some questions. If anyone has any questions, there is a Q&A feature down at the bottom of your screen. Please feel free to put questions in there. I'm going to go ahead and start though with some questions we received from registration. Dr. Salley, this one's for you. How can palliative care benefit a pediatric cancer survivor who is now a young adult?
I'm really glad you asked that question. I think practically speaking, we're lagging behind both in research and clinical experience in palliative care because there's so much effort in just getting people to use it while they're on treatment. That said, I think it can be really valuable during survivorship. As I mentioned earlier, there are, late and long-term effects of cancer treatment that can cause poor quality of life and quality of life issues, and including many of the same issues that are experienced on treatment, like pain, nausea, sleep problems, mood problems, and that sort of thing. And I think that Dr. McCarthy referenced this too, that perhaps your providers might try things along the lines of a protocol. Well, we usually approach pain with this, and if that doesn't work, we might try this. And if you've had that experience and it's still not working, that the individual's quality of life is poor and they're not able to do the things that you might think that they ought to be able to do or want to do, I don't see why you couldn't request a palliative care consultation at that point and voice your concerns in that way. And I can validate something that Dr. McCarthy said as well, is that these teams are really well known for thinking outside of the box and creatively with medications. And I think that brings a lot of value to anyone's life, no matter where they are from diagnosis forward.
I appreciate that. Another question that came in, and I'm going to start with you, Dr. Salley, and then Anne and Nils. I think your experience could also answer this in a different light. But how do I get other family members to understand the difference between the palliative care and hospice?
It's a really good question. Well, there's lots of ways to communicate with people, right? There's really direct communication, and then there's somewhat less direct communication. So I will honor that you know your bandwidth for what sort of conversations you can engage in. You can certainly provide some education yourself, or just direct them to really good references. You don't have to explain it or try to convince someone of what you know it to be true and what you know is right for your child and family. Certainly CourageousParentsNetwork.org has a lot of resources on what is palliative care and spells this out that you could reference family to. And there are other great websites with similar resources. So I think that's a great way. But also, ultimately, you don't have to convince anybody of anything, right? You're the parent to this child, and you will do what you deem best for your child and family.
Anne and Nils, do you mind speaking to how you shared the decision with your family, or if you did?
Well, we're probably not the best to ask that question because, as I said, it took us a while to accept palliative care. Guess what our reaction was when we heard about hospice getting involved. So, yes, hospice got involved, but it was very important for us to still maintain the main relationship with the care team. So, to the very end, we heavily relied on the original care team, including the palliative care team, even though hospice also provided palliative care and a palliative doctor. But we decided to stick with who we got comfortable with and who Martha got comfortable with.
And to add to that, I'll say that you can share with family about having palliative care involved. You can also call these people other things like pain doctor, nausea doctor, people that help us talk through our decisions, right? There are other ways to think about this. And in fact, at a lot of hospitals, the palliative care team isn't really even labeled the palliative care team. They have other names. They are palliative care teams, but they're helpers at the end of the day.
Dr. Salley, is there any specific criteria for beginning palliative care?
Not really. Just having a diagnosis of a serious health condition that it could be potentially life-limiting, although it doesn't have to be. It could just be a diagnosis with high symptom burden. In my opinion, I think every child diagnosed with any type of brain tumor ought to be able to receive palliative care services. And again, if you look at that standard of care paper, if we want to go back to the experts that I referenced earlier, there's no criteria there, right, that specifies severity or anything to that degree. So, so no, not really.
Okay. And I'm going to end with just one final question. Can palliative care benefit my child who is currently only having mild quality of life symptoms?
Yeah, I think it can. And I can answer that in two ways. One, if you think that there might still be room for improvement for your child, or you're curious if there's room for improvement. But also, if you think about that image that I put up where there's the child and family in the middle and those however many circles, there are all the other ways that palliative care can help that's outside of symptom management. So yes, I think there's space for palliative care even if a child's symptoms are relatively well managed.
And I think when you meet them earlier in your journey, you have more time to really build the trust. And if you really need them and you know them, it makes it much easier. So.
I appreciate that. Thank you. And that parent perspective is so important. Well, I want to thank you, Dr. Salley, Anne and Nils, for your time today. Again, for everything you shared with our community here. I'd also like to thank our attendees for your participation and your thoughtful questions. The PBTF is here to support you no matter where you are in your journey. So please reach out to us for support at the contact information on this side. We will be sending you a link to the recording of the webinar, as well as the slides from today's presentation and a couple links of further information at the Courageous Parents Network for you. Thank you and have a wonderful afternoon.